In the ever-evolving field of public health, knowledge is power, but understanding is essential. Without truly grasping the needs of your community, even the most well-intentioned health programs can miss the mark. That's where a health education needs assessment comes in, a process that enables us to tune into the heartbeat of a community and address its unique health challenges. Today, we'll guide you through this critical process step by step. From the busiest urban environments to the most serene rural settings, understanding the specific health needs of a population is fundamental to creating effective health education programs. Each community is different, with its own set of challenges, resources, and needs. Let's dive into the essential steps of conducting a comprehensive health education needs assessment. The journey begins by clearly defining the purpose and scope of your assessment. Are you aiming to address a specific health issue like diabetes management, or are you evaluating broader health education needs within a community? Establishing a clear objective is the compass that will guide every subsequent step of your assessment. For example, if your goal is to reduce the prevalence of hypertension within a particular demographic, your entire assessment will revolve around identifying the factors contributing to this condition and the community's awareness and knowledge levels. Remember, anything done for the community without the community is not for the community. Engaging the community from the outset is critical. Not only does this build trust, but it also ensures that your assessment is grounded in the realities and perspectives of those you aim to serve. Collaborating with local leaders, organizations, and residents provides invaluable insights and fosters a sense of ownership among the community members. For example, involving community members in focus group discussions can reveal cultural beliefs, practices, and barriers that you may not have considered, shaping your approach to health education in a way that truly resonates with the community. Step 3. Collecting data. Once the purpose and scope are clearly defined, it's time to gather data. This phase is about collecting a broad spectrum of information that will help paint a comprehensive picture of the community's health education needs. The data can be quantitative, such as survey responses and health statistics, or qualitative, such as insights gleaned from interviews and focus groups. For example, conducting surveys in a school setting might reveal a lack of knowledge about proper nutrition among students, while interviews with parents might highlight the challenges they face in providing healthy meals. Each piece of data is a puzzle piece that, when combined, reveals the bigger picture. Step 4. Analyzing the data. With your data in hand, the next crucial step is analysis. This is where the raw data you've collected begins to transform into meaningful insights. Look for patterns, trends, and gaps in the knowledge or resources that have been identified. The goal is to prioritize the most pressing health education needs based on the evidence you've gathered. For instance, you might find that there's a high prevalence of obesity in a particular community, coupled with low levels of physical activity. This insight could then direct your health education efforts toward promoting exercise and healthy eating habits. Step 5. Identifying resources and constraints. Identifying available resources and constraints is a pivotal part of the needs assessment process. No health education initiative can succeed without a realistic understanding of what resources are at your disposal, as well as the limitations you might face. This includes funding, available personnel, existing programs, and potential community partners. For example, if you're planning a series of educational workshops but have limited funding, partnering with local organizations or utilizing community centers could be a cost-effective solution that also strengthens community ties. Step 6. Prioritizing health education needs. With the data analyzed and resources identified, it's time to prioritize. Not all health issues can be tackled at once, so it's essential to determine which ones are the most urgent and have the greatest impact on the community. Prioritization ensures that your efforts will be directed where they are needed most and can make the biggest difference. For example, if your assessment reveals both high levels of substance abuse and a lack of mental health services, you might prioritize mental health education as a foundational step, understanding that improving mental health could, in turn, reduce substance abuse. Step 7. Developing an action plan. Now comes the strategic part, developing an action plan. This is where you translate all the insights from your assessment into a structured, actionable roadmap. A comprehensive action plan includes specific objectives, detailed timelines, assigned responsibilities, and clear evaluation methods to track your progress. For instance, if your goal is to increase awareness about diabetes prevention, your action plan might include developing educational materials, scheduling community workshops, and collaborating with local healthcare providers to offer screenings and consultations. Step 8. Implementing and evaluating the program. Implementation is where the plan meets reality. However, it's not just about rolling out the program, it's also about monitoring its effectiveness. Ongoing evaluation allows you to make adjustments in real time, ensuring that your health education initiatives remain relevant and impactful. For example, after launching a series of nutritional workshops, you might evaluate participant feedback and health outcomes to determine whether the program is meeting its goals. Continuous improvement is key to long-term success. Conclusion, inspirational ending scene. A successful health education needs assessment is more than just a formality, it's the foundation of any impactful health initiative. By understanding and addressing the specific needs of your community, you can make a real difference in their health and well-being. As Proverbs 4:7 reminds us, wisdom is the principal thing. Therefore get wisdom, and with all thy getting, get understanding. And remember, anything done for the community without the community is not for the community. Thanks for watching.